Hi, I'm David Harrington, Executive Director of United for Brownsville. I'm one of the founding co-directors of United for Brownsville. I've been here since 2018, and I'm excited to talk to you today about some of the accomplishments of United for Brownsville, or UB as I might call it. And particularly, I'm talking about our accomplishments in achieving equity and early intervention. A really quick primer on the neighborhood of Brownsville. It's a neighborhood in central Brooklyn. You can see it in here in red on the map. It's a neighborhood that's often talked about as being underserved, but there are actually a number of organizations that are nonprofits or working with city agencies that are providing services in the community. And the goal of United for Brownsville, or one of the goals, is to bring those agencies and organizations together to collaborate on projects. The neighborhood is also densely populated with people. It's about 90,000 people, depending on how you measure it. And it has one of the nation's largest concentrations of public housing. And because of that history of redlining and public housing and institutional and structural racism, the neighborhood has often suffered low outcomes across the board, which we view as a failure of cities, agencies, and services to meet the needs of families in the community. The way that UB works is really centered on our diverse group of stakeholders, and there are two bodies that drive us forward. One is the Family Advisory Board, which is composed of mothers, fathers, and grandparents who are raising or have raised young children in the community. And it's a really diverse group, both in terms of ethnicity, but also in terms of lived experience. And we think those experiences mirror the experiences pretty well of the community, and also give families who work with us a good background in what's working in the neighborhood, what's not working in the neighborhood, and how things could change to improve circumstances for their children, their neighbors' children, and their families' children. Working alongside the Family Advisory Board through monthly meetings and many intern meetings and other types of planning meetings is a group called the Provider Action Team, which represents an array of organizations doing work in the community. Anyone who works with families with young children is invited to participate in this group and to work alongside the small backbone staff of United for Brownsville and the Family Advisory Board to help achieve families' goals for improvement in the community. I want to give a really quick primer on early intervention, since that's crucial for understanding this project and the accomplishments here. Early intervention are services for 0 to 3-year-olds who have disabilities or developmental delays, and specifically it's between 0 and 36 months. It is a federal entitlement under the IDEA Act, and it is structured that way because there is a very narrow window of brain development when it's known that children can be best helped with interventions and services that will help them catch up as much as possible with their peers developmentally. The motto of early intervention unofficially is as early as possible so that children are not left behind by their peers. It is mandated and goes through the State Department of Health and is also operates locally through the New York City Department of Health and Mental Hygiene. The steps for early intervention are also important to understanding our accomplishments here. Each step is an opportunity for improvement, as we found, and crucial to reaching our end goal of equitable service receipt in the neighborhood. The first stage, and all these stages a parent must consent to continue through the process. But the first stage is referral, which can really be done by anyone, although not everyone knows that. And that could be a parent or a pediatrician or anyone else working with a child. And that's if a delay or disability is detected or suspected in a child 0 to 36 months, they're referred to early intervention. The next stage is the evaluation stage, which is a multidisciplinary evaluation and often can take as many as 5 or 6 different meetings and appointments to do evaluations, looking at a child's overall development for delays using native language. The third stage is eligibility, and there is a strict criteria for what makes a child eligible, percentages of delays, and whether there are one or multiple delays. And if a child is found eligible for services through early intervention, they're then connected to services. And again, parents must consent to this as well. Services are done by a state contracted provider who performs the services in the home, a daycare, another natural setting, and they can be services like physical therapy, occupational therapy, speech therapy, counseling, assistive technology, and so on. So each of these stages is part of the early intervention process. There are also stages that we receive data on, and there are opportunities for families to fall out of the process, but also opportunities for improvement. But let me talk about how UB worked on the issue of early intervention. And this actually represents how we would work on any type of project that we're working on, any type of systems change project. The first step of the work is building community, and early intervention really was our first systems change project. And so it coincided with the founding of the Family Advisory Board and the Provider Action Team. But we built a community of local stakeholders. That community identified barriers in the system. And at one of the earliest meetings of the Family Advisory Board, when we asked the group, what are the systems that are most impactful for young children that seem inaccessible to you? One of the first things that was mentioned, it was corroborated by a number of FAB members who'd had personal experience with the system, was early intervention. And families said a number of things about this, such as talking about times when they or their family members or neighbors hadn't trusted in early intervention and thought, a child might just grow out of it. They'd also talked about barriers within the system itself they'd encountered, such as pediatricians who refused to make a referral to early intervention, or times they'd struggled to schedule an evaluation because of shortages of providers, or providers saying, we don't want to work in Brownsville. So there were a number of barriers that were identified. And we brought those stories to the Provider Action Team after talking about it with the Family Advisory Board. And they said, you're really on the right track. This is something we've noticed too. We don't have a concrete sense of what's happening, but we think that there are many children in Brownsville who would benefit from these services who are not getting the services. And one of the barriers we saw there was that we just didn't have any data to back up what was happening. So we began to invite new partners in, and that included the Bureau of Early Intervention at the New York City Department of Health and Mental Hygiene. And they really turned out to be great partners. We contacted them in 2018 and really built up that relationship through the spring of 2019 when Lydia Ledniak was coming in as assistant commissioner there. And the Bureau was really forthright. They said, racial equity and equity of services is a priority of ours, system-wide and in your community. There are racial inequities in early intervention, particularly referrals for Black children, and particularly retaining Black and Latinx children in the enrollment process for early intervention after a referral is made. And that means that that predominantly Black and Latinx communities, including Brownsville, often don't receive services anywhere near the rates they should receive. We've tried to do a lot of outreach to those communities as a city agency, but haven't been having success. And we formed a partnership where UB was the direct line to the community because we built the diverse group of stakeholders. And eventually that led to the Bureau sharing data with us. And that data did in fact confirm what families were saying, what social service providers and others were saying when we analyzed it with them. And in analyzing that data, identifying the gaps in the data in that early intervention 4-step enrollment process we talked about, we began to develop theories that we could test about how we could move the needle and address those inequities that we were seeing. And through that, we've made a lot of progress over the years, including reaching our eventual goal of equity in early intervention. And we've repeated this process, working with the data, analyzing it, developing theories and testing them, and making progress since then. This slide is a driver diagram that we've worked on for years with the FAB and with the Provider Action Team. The end state is at the bottom, which is that we want to make sure the EI service enrollment rate for Black and Latinx children in Brownsville is greater than or equal to the New York City rate. And I won't go through everything in here, but at the top we have projects we've tested out and done over the years that we thought would move the needle. And there are 3 primary areas that we were trying to address here. The first is increasing referrals of Black children in Brownsville to the New York City rate or higher. The second is increasing evaluations for Black and Latinx children to the New York City rate or higher, and also reducing eligible children from dropping out of the process. So reducing that drop-off rate to the New York City average or less. I won't talk about all the projects that we've done over the years. One of them has been, doing a lot of focused work on improving screening and referral processes for social service providers and healthcare providers in the neighborhood. One of the most impactful has been an EI working group that we formed to address to reduce the drop-off at the evaluation stage for early intervention. We developed a conversation guide for families to build trust, and also many best practices about working with families and removing barriers for them at the evaluation stage of the process. And a key player in that is the role of the early intervention ambassador, which came about through this process we've discussed here. Families and social service providers we work with came up with the idea for the role. And at the time, this was a unique role in New York City and maybe anywhere else in the country. And she really is the point person for early intervention in the community. Her name is Danielle Herring, and social service providers and families alike can come to her when they're experiencing roadblocks in the EI process, and she works through the roadblocks with them, helps remove barriers, builds trust between families in the system, and gets them through the process. In addition to that, she's been doing a lot of outreach to other communities and to folks working citywide, such as leading trainings to the Bureau of Early Intervention in health and hospitals, but also working with new early intervention ambassadors that have been hired with other communities in New York City. And those are all modeled on her role. So let's look at the accomplishments. The first one is that we increased the referral rate for Black children in Brownsville. In all these slides, the Black rate for Brownsville is the dark blue line. In this slide, the New York City Black rate is light blue. And in all slides, the gray line is white children in New York City, and the yellow line is all children in New York City. And before we started this work in 2018, the rate for Black children was much lower than the rates for our white children and all children citywide, and even for Black children. So Black children in Brownsville were not being referred to early intervention at high enough rates. And you can see over the years, even through the COVID-19 pandemic, when rates of referral dropped everywhere else, the rate of referral for Black children in Brownsville kept climbing and eventually surpassed the rates for white children and all children citywide in 2022. So that was a major accomplishment. And we began to see that accomplishment early on, I think, just by raising so much awareness and working on screening and referral processes. Much harder to tackle was the dropout rate from the multidisciplinary evaluation stage. And we didn't completely eliminate the gap for the red line, which is Latinx children in Brownsville, and the blue line, which is Black children in Brownsville, and the rates for New York City. But we have that between 2019 and 2022, which was a major accomplishment. And this stage is much harder to impact because it involves multiple appointments that a family with low resources, maybe having a lot of other needs not met, and maybe having children with other difficulties would have a hard time getting through. So you can think about what it takes to get through a 45-day process with multiple logistically demanding, but also emotionally demanding evaluations. And maybe you don't have trust in the system from past experiences, and you can understand why families might drop out. So we haven't eliminated that difference, but we have that difference. And together with the increase in referrals and the halving of the dropout rate from the process, we eventually reached our goals, which was enrollment. And this chart here, the dark blue line you can see was always below the lines for all children and white children in New York City until 2022. And in 2022, for the first time, Black children in Brownsville received early intervention services at higher rates than children of all races citywide, and even white children in New York City. And we've even accomplished that earlier with Latinx children in Brownsville. So this work continues. We're coaching other communities, as I said, and we're also applying these same tactics to the child tax credit, to ACS childcare vouchers, and to WIC. And we really look forward to more success using the methods we used in early intervention. Thank you so much. If you have any questions, feel free to reach out to me.